Hello, today's Monday, November 6, 2023. Today I'm doing an update on malaria. Well, there was a news brief published by the Center for Infectious Disease Research and Policy, CIDRAP, at the University of Minnesota on October 24th, and they reported on an analysis published by Washington Post on October 24th, and it was about how climate change and demographic growth could put 5 billion more people at risk for malaria by 2040, 17 years from now. Now, of the 5 billion people expected to be at higher risk for malaria in 2040, 1 billion are in Africa. 300 plus million are at risk in South America. So what's contributing to this higher malaria burden? Well, warmer climates mean longer mosquito transmission seasons. Globalization of people and goods and services mean the migration of these pesky mosquitoes to new places. The net result is that you have a mosquito population that becomes more difficult to control. Now let's talk about malaria a little bit. Last year that data was available was 2021, and malaria killed over 600,000 people that year, and more than 3/4 of the victims were under the age of 5. Now, recall, here in the United States, there were 9 cases of locally acquired malaria. These 9 cases came from Florida, Texas, and Maryland. And these people had no travel history or travel exposure, meaning they were bitten by local mosquitoes who had acquired the malaria parasite. So how do you get malaria anyway? Well, again, these mosquitoes who are infected with the malaria parasite bite someone, and then they inject the malaria parasite into the bloodstream, and they go on and live and replicate in the body tissue such as red blood cells or the liver. Now, what are the symptoms of malaria infection? Well, I'm going to start with children because children, are very high risk. Early symptoms can include irritability and drowsiness, poor appetite, trouble sleeping. Then these symptoms are generally followed by high chills, fever, and sweating. So combination of chills, high fever, and sweating in children should alert parents to the possibility of malaria. Now, other symptoms of malaria include headache, nausea, aches and pains all over the body, and a large spleen. If malaria affects the brain, someone can have seizures or a loss of consciousness, and the kidney can be involved as well. So, none of this sounds real good in my opinion, but there is some good news, is that malaria can be diagnosed easily by doing a blood smear and treated if caught early. Now, what about immunity to malaria? Well, people can get malaria over and over again. In fact, that's the situation going on in Mozambique right now, where they're experiencing a huge explosion of malaria cases, and children are being infected 4 and 5 times. So, it appears that people who do live in malaria endemic areas develop some levels of immunity, but it's very slow to acquire. So, you might have malaria infection multiple times as a child before you become somewhat immune to malaria as an adult. So, again, it's the problem of mosquitoes, changes in the mosquito population. Now, we know mosquitoes don't just transmit malaria. They can transmit West Nile virus, dengue fever, chikungunya, and yellow fever, to name a few. So mosquito-borne illnesses are a threat to public health. In closing, 2040 is 17 years away, and I'm hoping that our scientists of today and scientists of tomorrow can develop effective tools to address the mosquito burden globally. Wouldn't it be nice to have a race to wipe out malaria instead of an arms race or a race to put humans on the moon or Mars? Surely it would cost less and we would save a lot more lives. So that's my message today. As always, take care and be well.